This renewal, Medicaid's Renewal Community Advocate Forum is your space to be able to engage, to give us that feedback, and to continue in our partnership for Medicaid renewals as we move forward. This dramatically helps us reduce the call wait times and any confusion, and it is meant to be a space for you to network and work with others in order to continue supporting our community. I'm joined in this space by my colleagues Chris Bresco, Stephanie Menders, Sierra Warnham, James Rajat, and Lisa DeMoro, who will be sharing and presenting later on throughout this forum. Let's jump right into the next slide. During the session, you'll learn more about where we've been and where we're going. We're going to do, we've already done our welcome and a recap. We're going to talk about operational updates, communication highlights, engagement and outreach next steps, and then we'll open the floor for a discussion. In a brief recap, we sent out a July news blast, an e-blast that really has a lot of information and also has a link to this advocate forum. Please share that link for this new series in the fall. There's a lot of information in there that we'll go through throughout this presentation today. We've also attended a number of back to school events, and we will continue to talk a little bit more about our engagements and our next steps throughout the slide. In our next slide, I'm going to hand it off to Chris Bresco, who will tell you a little bit more about our Medicaid renewals and operations and where we are now and how we're doing. Chris?
Thanks, Kyla. Next slide, please. As you can see, we are now halfway through the process. We've sent out our 6th month, at the beginning of September, we sent out our 6th month of renewal notices, which puts us at group 6. But we are getting closer to that December mark where we'll start engaging families with children and children. Just an update, as we're moving forward, I'll give you a little bit of context of these groups as we move forward. Of note though, right now, if you've been on the State Covered RI website and looked at the data dashboard, we are temporarily pausing the dissemination of data as we go ahead and we rework our process to provide a more clear, concise, and accurate depiction of our process. The data team is working tirelessly right now on a 2-week sprint. So on or about the 22nd of September, we hope to have the dashboard back up, with it being a entirely more responsive and a more accurate depiction of our progress. So with that being said, I was slotted to give you an update on all of the metrics concerned with the operational renewals. I'm not going to be able to do that at this time, but the next forum, I'll be more than happy to do so. Next slide, please. So what I can share with you is, as we hit almost 80,000 renewal notices having been sent, the takeaway from this is, and I know this is a question a lot of people have, is how many active renewals do we have, which requires participation from the beneficiary in the terms of returning documentation versus passive renewals. We are doing well in comparison to the other states within the country. We've maintained well over 50% of our renewals have been passive, which means no action actually needed to be taken by the beneficiary to maintain their benefits. With that being said, we've instituted a few additional waivers that CMS has granted us that has allowed us to keep this number high, and we'll continue doing everything we can to maintain that. This just makes life easier for a lot of our benefits and a lot of you all who help our beneficiaries with their process. Receiving a passive renewal notice is just a much easier way to move forward with their Medicaid benefits. Next slide, please. And another question that's come up quite a bit, and I did have some historical documentation on this, which was appeals. So as I said, we've sent out with the September cohort, almost 80,000 renewal notices. As you can see on this, with that, we have right now 120 incomplete appeals. Now, only 60 of those are close to reaching the 90-day suspense. We are backed up a little bit in number of hearing officers and the ability to schedule those hearings for those appeals. But the takeaway here is that we are now starting to see a large number of appeals be completed informally, which means without a hearing officer, without having to schedule a formal hearing, we've been able to satisfy that customer's appeal and provide them with the services that they need. Big note down the bottom in red, and this is a great success story for the process right now, is the SY24 budget, which started in July, authorized 3 new hearing officers. These 3 new hearing officers will go great lengths to taking down that number of hearings that are pending. Right now, they're conducting the second round of interviews of those, which we still have 39 candidates remaining. Once those second interviews are complete, tentative offers to those candidates are scheduled to go out on or about the 22nd of September. So we should be getting those hearing officers on board in the very near future, which will again help with that appeal rate. And the next slide. And with that, I'll turn it over to the communication team. I'll be more than happy to answer any questions now. Kyla, I'm not sure if you want to answer questions now or hold them all till the end, but I will be here till the end of the meeting to answer those questions that they may have.
Thank you, Chris. I don't see any questions in the chat, so why don't we head on over to our communications team. Stephanie Menders will be sharing the slides, and we have our wonderful Sierra behind the scenes making the magic happen. Stephanie?
Thanks, Kyla, and thanks, Sierra, yes, for operating the slides and doing the recording, and we'll be sure to send that out via email to the group afterwards as well. So hi, everyone. My name's Stephanie Menders. I'm the Chief Public Affairs Officer at EOHHS, and I'm going to be providing the communications update today. Next slide, Sierra, please. Just a reminder to folks, I know we've sent out some communications to you about this, but the Medicaid Renewal Lookup portal is now live on our website. If you go to the staycovered.ri.gov homepage, you'll see this orange button here with the magnifying glass. If you click on that, you can help a Medicaid member look up their anticipated renewal date. And I also wanted to show that we have a couple new flyers to help promote this new tool. You can download those on our website as well. And we also have a PowerPoint slide deck that walks you through the steps on the portal as well. So there are screenshots of exactly what you'll see on the home page of the portal, the successful query page of the portal, as well as the unsuccessful query of the portal. And just a reminder, it is available in 3 languages, English, Spanish, and Portuguese. And we also heard from some partners that there may be some confusion about Medicaid ID numbers, because all you need to use the portal is your MID and your date of birth. So we did add an example of a white anchor card, an image of the white anchor card on the portal. So that way folks can see an example of, here's the card that you can be using to find your Medicaid ID number. And we highlight where on the card that Medicaid ID number is as well. So we hope that that'll help. But if you've been hearing anything about the lookup portal, if you've been using it, if you found it helpful, if you've hit any snags, if you can put that in the chat to let us know, that would be great. Any feedback is really appreciated. We're going to continue to monitor statistics related to the portal's use and make sure that it's a helpful tool for folks. So appreciate any feedback that you may have. Next slide, please. Next, I want to highlight a couple new videos on our website. The first is a webinar recording. Our colleague Anthony Salvo gave a presentation to Benefits Data Trust just last month, where he highlights some of the efforts that we're making in Rhode Island to make sure that folks stay covered. You can watch a recording of that webinar on YouTube. It was attended by by folks from across the country, and we had some really great engagement and conversation on that call. So kudos to Anthony as well for a very positive presentation. And I also wanted to let folks know that the Healthy Road app tutorial videos are now available on YouTube in Spanish. We had shared those previously in English. And so the Spanish versions are now up, and the Portuguese versions are also in development. And as a reminder, that's just a series of videos that show you how to use different features on the Healthy Road mobile app. Next slide, please. And next, I want to highlight some of our materials that are in development for households with kids. As you all know, we've been talking about renewals happening for households with kids between December and April. And we know that this is going to be a very big priority population for us to reach in communications and outreach. So I just wanted to plug in some examples of what we're working on here. Up top in the left, you'll see some screenshots from our toolkit that's in development. We're going to be sharing this with schools, childcare, any of you community partners and advocates that can help get the word out to households with kids. It'll have sample social media posts and images, resized and everything for each of the different platforms, available in multiple languages, all in the document that you can just copy, paste, and download. So it's hopefully easy for you to share. We'll also have a draft email blast, text message, and robocall scripts, since we know that some of the schools in particular rely on those sorts of communications with families. I've also got an example to the right of that of a palm card that we'll be sending to schools to redistribute, in particular to elementary school age children to bring home in their backpacks. We'll have that available in multiple languages as well. And also an example of a couple of flyers that we have in development that we will get translated into different languages as well. And we will make sure that it's all posted on our Stay Covered website so that you can easily download and share these resources with your community. Next slide, please. Next, I wanted to highlight some of our analytics and metrics on the Stay Covered site. Since we launched, we've had about 49,000 users and 101,000 page views. In the last reporting week, we've had about 2,400 page views, and you'll see our highest ranking viewed pages there. The homepage, the sample renewal notices, information about how to provide required documents, our educational materials, and our information for Medicaid members. Next slide, please. And here you'll see some user traffic from our mobile app as well. We've been happy to see this number increasing. And you'll see that back in April when we started renewals, there were about 16,000 total users on the app. And right now we have just over 21,000. And we are averaging about 1,000 documents being uploaded into the app each month. Next slide, please. And lastly, just a reminder, we shared this last session. We'll probably continue to share this, but this is the big push from us here in comms. If you can help us spread the word by visiting staycovered.r.gov, downloading any of our educational materials that are available there, and sharing with your networks, that would be greatly appreciated. And then just resharing some key messages for households with kids as we prepare for that timeline to begin in December. And again, we'll share these slides after the fact, so we encourage you to click through and save whatever may be most helpful for your organization. Next slide.
Thank you so much, Stephanie. Thank you again, and thank you everyone in the room. All of your support has been helping us to bring down calls. We also know that although we have a lot of tools out there that people can use virtually, that it's not always easy for people. It might not be their first step. So I want to also thank you again for being those champions in the community that are using some of the technology how-to videos to share those tools and tips on how to navigate the Healthy Road app and how to navigate other websites. So I really, really appreciate that everyone using those functional videos, for you all being those champions in our community, those trusted voices in our community to help bring down traffic on the call center lines and also help with members who may be having trouble. Let's go to the next slide and we'll talk a little bit about the mini grant application. The mini grant application is up. We've extended that timeline, so you have until the end of September to apply. People are using this mini grant to buy tools to help out in the community. They are also using it for training, like the SHIP training and the certified application counselor training. So please look into that and apply. We'd love to expand our support. The next slide is going to be the Medicaid. It's going to talk about the community partner assessment, the needs assessment we conducted, and I will turn that over to James Rajat to fill you in on that assessment. James?
Happy to do so. Do we have the slides?
Sierra may have lost connection. Let me see if I can share them real quick.
Awesome. Just easier to go through it with the visuals. Apologies for the technical difficulties of our network sometimes. Thank you so much, Stephanie. I appreciate it. So many of you may have seen this already. It is posted on our website. EOHHS, our Medicaid program, Department of Human Services, and others worked with the Faulkner Consulting Group to do an assessment of additional outreach and activities that might be needed or that could help with improvements. When we first started this process early in April through June. And we also did this in partnership with our colleagues at HealthSource Rhode Island. I don't want to forget all of our key agencies on how we could best support clients. It was to define the expectation and understand the current baseline for community partner engagement in this space. Look at those who work with specifically our target populations, those most likely to be left behind through this process, and provide a list of recommendations for the state to work through on making improvements to improve the quality approach that we are taking with our outreach efforts. Next slide. So what we provided in this assessment was looking at the readiness for both basic assistance around our programs and then renewal assistance across a variety of different networks, whether it was our navigators, our community partners that have or do not have certified application counselors, and then as well as various state outreach and field workers that assist clients day to day. And so you'll see the assessment here in terms of where there was readiness that already existed, capacity that could be improved, it was limited, and then areas where there was additional need required. Many of the areas where there was additional need required, no surprise, was around the restart of these renewal processes. Next slide. So what we identified in terms of filling those gaps in conversations with the community partners and from the evaluation that FCG provided were five key areas. One, centralizing information. Two, thinking about having mobile assistants or mobile assister teams. Three, more and additional culturally appropriate and translated materials. Four, escalation processes where needed. And five, additional training opportunities. And so those were key themes that came out throughout talking with the different organizations, including many of you who are on this call. Next slide. So what we have done based on those findings already was we worked with community partners such as yourselves to reorganize the Stay Covered website. And we took an end user design for that. And that has been extremely helpful. We have seen changes in our user traffic. We have seen the most important pages being clicked on, and we have gotten feedback from you as partners around the helpfulness of that site. So that has been done. We then further went engaged and move forward towards the 12 languages that we see in our Medicaid system as members to move forward with those additional translations in those 12 languages, and many of our materials now are. And as we continue to have new materials, we do the entire translations, not just the top 3. We also did a complete plain language review of our website to bring the reading level down. The one exception to that is the pre-designed notices that we cannot change, but the rest of the information should be reflective of a lower reading level based on our conversation with community partners. We are identifying, we are working on identifying our ability through both funding and community provider interest of having these community assisters, or at least piloting community assisters as we move forward with households with kids. We will hopefully provide an update on that at a later forum, but that is still in process. We are also looking for after-hours escalation processes for particularly concerns that might happen if there's a glitch in coverage for a child. And again, we will report back on what we learn between what is doable, feasible, in budget and scope, and helpful to partners. And then lastly, it was around additional training, which we incorporated into our mini grant processes. And we are now working on, or completed our back to school events, and are now working on a variety of our engagement with new partners for households with kids that were not part of our first probably 6 months of our advocate forum. So those are where we are headed moving forward. Next slide. So I think our question, or a few things that we wanted to share with you all before we dive into questions, and then I'll turn it back to Kyla, is I want to remind folks that the mini grants are available, that they are, the timeline has been extended. And we did that because when we initially put out the mini grant, the Medicaid lookup portal, the quick lookup portal, was not live yet. And now that it is, we want to make sure that you all know that that is an eligible cost in terms of using that that portal with members to pre-identify dates for renewals. And so if there are tech needs, hours that are needed, other things in order to do that and support that and understand that for your clientele, that it is appropriate to submit a mini grant. So I wanted to just flag that for folks, that it is a new resource, but it is indeed eligible through that. Same thing if you are looking to pilot the community assister and have someone who's out there and you as an organization feel equipped to do so, open to that as well. So those are some additional items that we wanted to re-clarify, and therefore have extended the mini grant opportunity given the availability of those new resources and these new ideas that have been posted on our website. So with that, I will turn it back to Kyla and the team. I think we had a few questions we were going to ask around experience with the portal and some other things, just to get some additional community feedback. But again, I will defer to my colleagues to moderate that conversation.
Thank you, James. If we could come off of our screen share and come back into community. If we need any of the slides, we're happy to put those back up. But I believe that we're going to start off with Jody. She had a question in the chat. Jody, can we hear your voice and bringing it up into the space?
Yes, hi. Hi, Jody from Neighborhood Health Plan of Rhode Island. I'm sorry. So using the portal, we're finding a lot of times we see results that say, I'm sorry. I can tell you exactly what it says. I'm sorry, we can't find your information right now. And it probably shows up maybe 30% of the time when we're looking them up. Is it because they're in the middle of their redetermination, like they're in a group already? Like, is there a reason for that? If you have a definition for that, that would be great.
So this is Lisa. Hi, folks. I don't know if any of our colleagues on the line can answer that, so we can always take that back. I just want to, let me just ask Jody, So you absolutely know you have the right date of birth and the right MID number.
Yes,
So it's not a question of that, and the spelling of the name, everything is what it should be, and you're still
Yes.
getting that returned. Okay.
And I see some other
Chrissy-
folks, Lisa, in the chat
Yeah.
saying they have that similar experience. So one of our questions was on average, we're seeing between a 30 to 50% failure rate. So this
Yes.
is timely, and we wanted to ask about that. So what I would like to do is if you could send us some examples via email
I have
of
some
who
right
you're
now
looking
for
up,
you.
and we
Yep.
can have tech take a look at that, that would be super helpful.
Yes.
Okay, who should we send them to?
Lisa, can I have them go to you and then you and I?
Absolutely.
Perfect.
Okay.
You guys, I think everyone knows my email, lisa.tomorrow@ohhs.ri.gov. But yeah, send them to me, and I will share them with Nicole and team and just see, because that's very curious. I think to me, I
Okay.
guess it sounds like my colleagues have heard about it already, but I hadn't. So yes, we'll take it back. Thank you.
Thank you. Thanks.
We also had a question at some point around right now our Spanish and Portuguese lookup is low. So we had a question around for members, one, do we need to do an additional push in those languages around the lookup portal, and how can you all help us with that? But also, if folks are not using it because of either translations are issues, or if the way that the date and things are entered is problematic for clients. So we just wanted to think about that as well. And so if you have any recommendations or are open to helping us promote that in those languages, again, there's the mini grant opportunity. Connect with our comms team, we'll get you resources. We do want to continue to put this out in other ways. If you can do that in social media in different languages, also would be really helpful.
Thank you for that feedback. I know we had another question in the chat, but that partner is currently on the phone. So I want to make space for anybody else to ask any other questions, or any other questions from our team that they want to ask in this space.
I think I'm curious, while we have all of you folks on the line, in terms of, we have done some expansion where we're, in terms of our call center and routing calls, so that, we get people to the place they need to go to, not on, again, there's definitely wait time still, but our folks, we haven't gotten a lot of complaints that people are not, getting through to someone if they need to talk to someone, which is a fabulous thing. And I want to trust that. I just want to make sure that, no one else is hearing differently. So again, I know DHS also has done a lot of work to try to figure out how to get these calls answered. And so yeah, I'm just curious, is anyone finding any issues, or are you pretty much finding that people are getting what they need? I think I didn't see any, I'm not sure, I didn't check the chat, but I think I'll take that as maybe no news is good news, which again, we all want to trust that it is. We just want to make sure we're not missing anything, so.
Thank you for that question, Lisa.
Yeah. Thanks.
Nicholas, I know you had a question in the chat. Can we lift up your voice, please?
Yes, my apologies. You always get nervous when it's a phone call from one of your kids' schools.
Absolutely, understand.
Yeah, so sorry about that. No, I asked a question related to having a complaint mechanism. I probably articulated it better in the chat than I will be able to do this now. But, we talked a lot in the past year about conflict-free case management. And, that you're asking providers to educate Medicaid beneficiaries that are our clients about the process, and that to take notice when they receive information about the process in the mail or through any other communication. However, I'm hearing anecdotally within my own provider community of a couple of providers that are not just educating, but going beyond and helping their clients fill out their renewal forms or gathering financial information, etc. And so I don't know whether there is a complaint mechanism, because I assume that that crosses some sort of boundary within the Medicaid program. And I would venture to guess, although uncertain, that it violates their Medicaid contract as a service provider. But is there a complaint mechanism to be able to provide the Medicaid program the ability to explore and investigate these complaints? I have not seen one on the website, and the team at OPI has been less than responsive to my question.
So guys, can I take this for a sec? Is that okay?
I know I'm in trouble when Lisa jumps in.
No. Oh, no, I hope I don't have that reputation.
No.
Nicholas, a couple of things. One, when you say, just so we're clear, when you say there are some providers who, I don't know if you're comfortable being more specific. Is it a certain type of provider? Is it like home health agencies, for instance? Okay.
But yeah, what I'm hearing is, and I don't have evidence to submit a complaint myself, but I'm hearing a lot of buzz.
Okay.
And I will tell you is that at least one of them is a member of my trade association.
Okay.
But they are personal care attendant agencies, or I don't like the term non-skilled. And that they serve a specific non-English speaking population. A minority population is the predominant or sole grouping of their client base.
So my feeling, and I certainly will take this back to our policy team and also our program integrity team, but and I have a meeting actually right after this with my senior staff, so we'll talk about this. But I believe that if an individual is able to make a decision and they make the decision that they trust their aid and they want them to help, I don't know that there's anything that would prohibit that. I believe if it's someone who is not able-bodied and not mentally able to give consent, that's an issue. But let me take this back and find out, but I want to just clarify, you're saying basically that you have heard but don't have factual information.
I have not witnessed it.
A lot of buzz that people in the community are getting assistance directly from their home health aide to complete the application, which again does include financial information for the long-term services folks. And you're concerned that that may violate some contractual language or some kind of, customer confidentiality or whatever. So
it raises an ethical red flag, at least for me. And no, it's not. I'm not hearing that it's the aide. It's either the nurse manager doing the 60-day assessment or the administrator themselves. And I'm hearing about this for a couple of different agencies.
I'll take this back, Nicholas. My sense, and again, I probably shouldn't even have a sense until I confirm, but my sense is, again, any consumer can basically reach out to any trusted partner, as Kyla always uses the term, which I like, because if a consumer works with an agency and they trust the agency, then and the agency's willing to help, I don't think there's any conflict in that. But what I will do is I will bring this up and I will make sure, and we will we have everyone's email from signing in. We will make sure that we send something back out to clarify whether or not that is an okay thing to do.
Yeah. I guess my reaction to that is I'm a little surprised, because when we talk about other things such as, appeals of authorized hours, that the client cannot bring the home care agency representative to those hearings. So I will not share your answer at this time and wait
Yep.
for a more formal response, because I think that would change the culture of renewals, that now, that message would mean, or at least I interpret it as, that the home care agency should be more proactive in offering assistance in order to be able to maintain the services that they provide to their clients. So I don't think that that's the behavior that EOHHS wants to promote. And as a good friend of your state agency, I'll wait for a more formal response.
Again, let's wait and let's come back and I'll get you more definitive information. I think for, in general, my feeling is, again, no one would be, mandated or required, or we wouldn't even, necessarily encourage folks to, you use your stuff how you feel, right? But if when agencies offer to assist, we usually see that as a positive. Now, again, let me go back and before I say any more and get something
Sure.
definitive.
Yeah, Lisa, I think the three things that I'm hearing that we should
Yeah.
confirm is when it comes to provider-led assistance
Yeah,
for renewals, the first question is, do the flexibilities that were provided to MCOs, for example,
yeah,
to assist members apply to other provider types?
yeah.
Secondly, are there any red flags or concerns or lines that are drawn because of the concerns about fraud?
Yeah.
And then third, does conflict-free case management approaches apply to renewals so that there's a separation between awareness, education, and outreach, and then actual actions and decision-making related to applying or renewing someone's services and eligibility. So I think those are the three questions that from the chat and from the conversation here that I've heard. Anything that you would add, Nick?
Just a fourth question is
Okay.
to take a look at this from an equity lens.